Focus now on pregnant women, and we know they're generally not immune to viruses like flu that cause breathing problems. Now, with the outbreak of COVID-19, the big question is whether pregnant women are susceptible to COVID-19 and whether they can pass it to their unborn babies. To look into this, I'm chatting now to specialist obstetrician and gynecologist from Wits University, Dr. Shastra Bora. Dr. Bora, good morning, and thanks so much for your time. So let's talk about the risks and the dangers that pregnant women might face at this time, because as we said, at the best of times, they are vulnerable because they're not allowed to take certain medications. So what are their risks at the moment? What are the risks they face?
Good morning, Yuveka, and to the rest of the country, and thank you very much for having me. So with the evidence that we have, being it very limited, and with the many unanswered questions that we have with this pandemic, we are aware currently that pregnant women are not more at risk than the general population. However, this is a vulnerable group, as has been mentioned in prior pandemics throughout the world. And with the evidence we have from SARS, from the Zika virus, as well from the MERS, we do know that this vulnerable group can be highly affected from the mother to the fetus. Of note, there has been no transmission that we have found that has moved from the mother in utero to the baby. But this group of patients needs to be more vigilant now than ever.
What are the precautions they need to be taking if a mum is about to give birth sometime this week, today, any time now? What are the necessary precautions other than the obvious ones that the entire world is taking at the moment, especially depending on what type of birth they've chosen as well?
So I think you're absolutely correct. The precautions that are universally or globally being recommended for every individual is pertinent to the pregnant mother. When it comes very close to the third trimester and to the delivery, the precautions that need to be taken into play would be adequate screening of every pregnant mom to make sure that there isn't any symptomatic cause of transmission, because there could be release of a viral load from the virus to the baby at the delivery. It needs to be in a specific center that is well equipped to look after both the mom and the baby, from protective personal equipment, from a healthcare perspective point of view, and the delivery needs to be conducted in an environment that is safe for both the mom and the baby, respecting the mom's needs as well as protecting her autonomy during the delivery. There has not been any difference shown between delivery from a normal vaginal birth versus a cesarean section, but all of those indications need to be relevant to each pregnancy and individualized.
And what of the newborn themselves, Doc? I mean, when they're out there, when they come into this world, they are in for example, a hospital environment. How susceptible are they? I mean, they would have that first round of vaccinations, but what are the risks, if any, that the newborn itself actually faces?
So there are risks with transmission that could occur with horizontal transmission, meaning that when the baby is out in the environment, from contact precautions of surfaces within the room, and therefore that specific delivery area needs to be well cleaned, needs to be taken care of. All the contact personnel within that environment, good hand hygiene, good contact precautions in trying to prevent any form of transmission to the newborn.
And what about breastfeeding and all the other sort of care that's involved, and especially from a mum? If a mum, say, for example, has tested positive, and like you say, not necessarily there's no proof that they pass this on to the baby. When the baby is born, what then?
So initially it was thought that we would need to separate the baby from the mother if the mom was a patient under investigation, known as the PUI, or had tested positive. But as this has evolved over the past months, we've realized that separating a newborn baby from the mother can actually be more detrimental from the both of them, from the psychological aspect and from the actual development of that newborn. It is advocated now that the mom and the baby stay into close contact with one another, that breastfeeding is initiated at least 1 hour after the delivery, and that you have that kangaroo care and contact of the baby to the mom. There are precautions that need to be taken. Again, the universal precautions that we speak about with the adequate hygiene, with respiratory etiquette. If the mom has been a suspected case or confirmed, we do advocate for her to wear a surgical mask so that there's no droplet transmission through to the fetus. We do advocate that she cleans her hands and uses all the necessary hygiene techniques before handling the baby and breastfeeding. And once that feed has been completed, the same would be true. cleaning hands again, and making sure that there's no contact from surfaces that could have been contaminated to the baby.
And Doc, obviously there will be some concern as we hear of more and more health workers who are being infected. Let's take, for example, St. Augustine's and the number of nurses and the news we're dealing with coming out of there over the past couple of days. What's within the rights of the mum or the parents to suggest in terms of keeping their baby safe, especially now where we just don't know. We don't know who's carrying it in a hospital.
We don't. I think that it would be vitally important for us to abide by the universal precautions and to keep that degree of social distancing. It's going to be a very difficult time for the pregnant mom, the delivering mom, and the new family that has a newborn. The excitement that everyone normally entails with the happiness of having a new delivery may not be there because of the elements of social distancing. So the one thing I would definitely recommend is abiding by universal precautions, hand hygiene, respiratory etiquette, keeping distance from people who potentially may be asymptomatic transmitters, as well as having the emotional and psychological support that these families would need, having the relevant societies involved should they need the support, and telephonic reinforcement from loved ones to ensure them that they do have the support, but because of the crisis that we're all experiencing at the moment, there may be no contact to that newborn baby.
And you also have the right to insist then that medical staff take extra precautions. You can insist if you see that they're not in these hospitals.
Yes, I would advocate that every individual who is experiencing this at the moment has a right to protect themselves and has a right to request from someone else to either keep their distance or refrain from being near them or the baby if they have symptoms of a sore throat or if you've noticed someone that's coughing. I would be very surprised if healthcare workers, specifically with this vulnerable group, but with people in general, do not wear the correct protective personal equipment before approaching any pregnant mom or newborn baby.
All right, thanks very much for your time there, Dr. Susceptible, just talking to us about the impact on pregnant women and newborns as well.